Welcome back to Ask Dr. Mia podcast. Today I have a special episode for you from my colleague and friend, Molly Hinely. Molly is a pharmacist manager for the Atrium Health Wake Forest Baptist Health Pharmacy Population Team in North Carolina. And she really focuses on transitions of care when patients move from, say, the hospital to a rehab or to home, and works with a group of really dedicated professionals such as nurse navigators, social workers, and community health workers. She's also training the next generation of pharmacists as the residency program director. And so she's quite busy, but she has gotten her pharmacy degree from the University of South Carolina and finished a pharmacy residency at New Hanover Regional Medical Center in Wilmington and has been in practice for more than a decade. And so, welcome to Ask Dr. Mia podcast, Molly.
Thank you so much. I'm honored to be here.
Wonderful. Well, Molly, tell me a little bit about who are you taking care of in your life right now?
Yeah, so I am currently a mother of an 8-year-old and 6-year-old, two sons. I also am the sandwich generation, and I have two aging parents that I couldn't live my life without because they pick my children up every day from school. But I have a father who just turned 78 and my mom who turned 76, as well as my in-laws who are 79 and 77. They live in Georgia, but we constantly are getting calls from them to help with medical care. And so I tend to be the pharmacist for the whole entire family too. I have two brothers and niece and nephews that I tend to ask that I get all the medication questions asked for me.
So you're my perfect audience and a wonderful guest for this episode because I know we have a lot to talk about in terms of medications, and you have not only professional experience but also personal experience. So one of the questions that I get asked a lot, and I'm curious about your answer, is that how do you get your loved ones who might have memory problems to take their medicines?
Yeah, it's a great question that pharmacists are really well positioned to help with. And I have always had a passion for since I became a pharmacist. My background was primarily in acute care, and I actually saw it from that side where patients were coming in, especially patients with memory loss. And the reason why they were admitted was because they just couldn't remember to take their medicines. And it seemed like such a simple fix to be able to try to get them to take their medicines. And then when I switched into transitions of care pharmacy, and I created the pharmacy home visit program, and I went into people's homes and actually saw what was happening in real life experience with these patients that have true memory loss. It's very, very hard to figure out how to get them to take their medications. The most important thing is if there's a caregiver around to have that caregiver support, because there are a lot of unique tools that can help with getting patients to take their medications with memory loss. The number one most important underutilized tool, in my opinion, is the community pharmacist. So everybody has to fill their medications somewhere, and pharmacists are well positioned to really help with helping people take their medications. In most of the community pharmacies, you can find pill boxes that you can buy over the counter. A lot of times I try to say, start with a simple pill box, keep it simple as much as possible, to try to decrease the burden of the caregiver. Some of these fancier medication boxes, especially the electronic dispensing ones, they're so cumbersome to get set up in the home that a lot of times they don't even know where to start. And so then, especially when you deal with electronics, if it malfunctions, you have to get on the help desk. Most of our caregivers are working full time, and that's the last thing that they want to do is try to help figure out how to put these medications correctly into these electronic dispensing systems. But there is a great place for them. I think easy solutions too is setting alarms or trying to remember to take your medicines with your normal routine. So taking your medicines with your coffee in the morning, putting it by the coffee maker so you can remember. It's okay to have a few different pill boxes because of that. We have our single daily pill boxes. We have the twice daily, 3 times daily, 4 times daily. And we also have those pill boxes that have gentle alarms that will alarm in the house too, if the patient needs that. I know I've gotten feedback though that especially depending on where the patient is in the stage of memory loss, an alarm can make them aggravated and they don't remember what the alarm is for, and they've even called 911 and thought
Oh
that
no.
it was a fire alarm going off. So we've sort of, there's pros and cons to everything, but I do think really reaching out to your pharmacist to ask for these medication strategies. And then one of the biggest things that the community pharmacist can do, as well as population health pharmacists, and that's the team that I lead at the Atrium Health Wake Forest Baptist, is trying to decrease the frequency of the amount of times patients have to take medications. So simplifying the medication regimen, and that way they don't have to take medicines 3 to 4 times a day. If we
Yeah.
can, some medications we can't help that. Um, Other things is changing patients to the transdermal options if we have that. But again, somebody has to remember to remove the old patch and put a new patch on.
Yeah. And that
So,
sometimes can be hard for a caregiver who might not be living with the person with the memory loss to do. I
yeah.
do want to ask a clarifying question about the community pharmacist. When you say community pharmacist, you mean wherever people pick up their medicines, like CVS, Walgreens, or their local pharmacist. When you go, how do you ask for a consultation with the pharmacist? Do they sit with you and go through your medicines? How does that work?
Every pharmacy is a little different. This is where I really encourage patients to use our independent pharmacies in their local communities. They tend to have a little bit more time to do exactly what you just said. Sit down with the patient, review their medicine. Sometimes they'll even fill the pill box for the patient to get them started at the pharmacy. And after they even shop around and say, this pill box sounds like it would be good for your medications. It looks like you take twice a day medications a lot. Let's get you on this pill box. And then they set it up for you. And then they also do the one of the most important things, telling patients and caregivers why they are on the medication.
Mm-hmm. Mm-hmm.
Even in our population health team, we do a lot of telephonic outreach. And it is so powerful to even just talk to these patients on the phone because most patients don't know why they're taking their medication.
Yeah.
You know,
So even as a caregiver, you could potentially make a table. And I
yes,
remember doing this when my mom was on several different medications for her Parkinson's disease that had, with her Parkinson's med, that's like she was sometimes taking it as frequently as every an hour and a half or 2 hours.
yes,
That I mean, she obviously knew what that medicine was for, but there were some other medicines where she didn't know which was which, and she got confused. Kind of, was this for my nausea or was this for my constipation? And well, I tried
yes,
to put a table and say, this is what it's for. This is what the pill looks like. This is what the
yes,
bottle looks like, and that just ideally just it doesn't even necessarily need a independent pharmacist to help you with if you just kind of get all the bottles lined up and take out as you taught me actually, Molly, to
Yes,
kind of take the label for the bottle or for the medication and tape one of the
yes,
actual pills
yes,
on a piece of paper that says, oh, this little red one is for my cholesterol, and I take that to prevent me from having another stroke, and
yes.
I take that at night.
Exactly. I'm so glad that you still remember that.
Yeah,
That is the number one.
ingenious.
I mean, when we have our pharmacy learners, we have about 27 pharmacy learners rotate through our space. And the thing that I love to show them is the things that are happening in real life with these patients. And especially when we were doing more home visits, I said, get ready to get your arts and crafts out. And again, exactly what you said, a caregiver can do this. All you
Hmm.
need is a piece of paper. And even if you print out a calendar, we
Mm.
do that a lot where it could be a weekly calendar or a monthly calendar. And a lot of times, too, it helps to write in your daily tasks of what you do every day. It gives that patient a sense of purpose for the day, too, a routine. And in that, you have those medications. Love taping the medications on there because unfortunately, um, these medications sometimes can change in appearance.
Hmm.
So your statin medication may look different the next time you fill it, and that's even more confusing. And
Yeah.
so being aware of that so you can re-tape the new pill on there. We get a lot of calls to say, like, I don't think they filled my medication right. It looks different now.
Yeah. My little blue pill is now a white pill. And you're like,
Yes.
why did they do that? Why did they do that to confuse everybody?
Yes, we need to talk to the drug manufacturers and say, can you please just stick to one color for your medication? It would help us a lot.
You really would. So, diving a little deeper into pros and cons of some of the technology surrounding pillboxes, and I love what you said about keeping things simple, because some of the more fancier medication dispensers, there's pros and cons of each one. Well, first of all, where do you encourage people to find them? Obviously, in a local pharmacy on the shelves, they're usually just the regular pillboxes that you open manually.
Yes, it's a great question. I think caregivers and or patients and your healthcare team can help find those types of options for you and figure out which one truly fits your lifestyle. It's like that philosophy of one size does not fit all, and figuring out what really helps your medication regimen. And so once hopefully we can decrease the frequency of the medications, but if you do have to be on multiple times a day medications, there are a lot of electronic options like the Hero pill dispenser or the MedMiner dispenser. You just put it in the Google search and you learn about it from the website, and they actually talk to you about different payment options because that's one of the biggest things with these is they can get pricey, and that's why a lot of times patients can't afford it. There are different options. The cheapest option is on Amazon right now, and it is a 28-day pill alarm box, and you lock the pills in a slot, and then it alarms when it's time to take it out, and it opens up for you. And you simply pay for that one time, and then you have it. Versus some of these more robust types of electronic pill dispensers, like the Hero one that's getting a lot of press right now, is you have to pay a monthly subscription fee. And some of the Medicare plans are actually paying for these options for patients. I don't see a lot of benefit. I don't see a lot of plans covering them, if I'm being honest. But it is it is a sort of a big machine. It
Machine.
almost looks
That's
like a Keurig coffee machine.
yeah, yeah.
And the hardest part, like I said before, is just getting it set up. The
Yeah.
thing I like about Hero though is that they do have that remote monitoring system attached to it. So they actually have, if you want to buy into the more like Cadillac service option of it, and you don't have a caregiver that is reliable per se for every day or every week to check in on you, you can actually do remote monitoring with that system. And if the patient doesn't take the medicine, it alerts the Hero company, and then
Hmm.
they give that patient a call and they say, hey, you, Mr. Smith, you really need to take these medicines. Can you find your Hero pill dispenser? They should be dispensing right now.
And that is a particular machine that I know both you and I have sort of tested it a little bit from the
Yes.
company itself. My concern with Hero or any sort of dispenser that relies on a weighted cup that kind of tells the machine whether it's been taken or not is that I know plenty of patients will just take that little cup, whether it's plastic or metal, and take it with them somewhere else. So it's off. I mean, it looks like it's taken by the machine, but potentially people could, throw it down the trash can or hide
Yep.
it in their bedroom and nobody will know because, unless you go in to actually look for it, it seems like it may be taken.
Yes. Yeah. You have to keep all the components, and I agree with you. I honestly like the like I said, keeping it simple. I prefer the best low price dispenser right now is the Live Fine 28-day automatic pill dispenser that you can find on Amazon. You just Google it.
Live
And
fine.
yes, and it's easy to set up. But it does have that alarm. So,
Hmm.
if you do have a patient that can get easily aggravated or won't remember what the alarm is for, that is the con of it.
Yeah,
Um,
and we'll link these in the show notes as well. There's one other website that I also recommend to people fairly frequently, and that's called alzstore. .com, ALZ, like in Alzheimer's, and that's a slightly more curated list, and it doesn't include just pill boxes, but also some other technologies like door switches to prevent people from
yep,
just unlocking the door and running out into traffic.
yep,
It's slightly more, I find it slightly more manageable to browse because
yeah,
Amazon, it just has so much product that
yeah,
you sometimes don't know like what you need and it takes too long to find what you need.
yeah,
Our store kind of just simplifies it, so you don't have as much choice, but you do have, you can look on there and say, oh yeah, I wonder if there's something that's similar to this that may be cheaper on Amazon or online, even if you don't necessarily look for it. And some of these technologies I wouldn't even have known that
yeah,
existed, like a fake lock that the caregiver can open because it's a little bit complicated, but it's not like a deadbolt that locks people in from the
sure.
inside.
Yeah, I love that. Yeah. I found another website that it was just like alzheimers.com, and it seemed to be pretty user friendly and talked about some good stuff, but I will definitely use that website that you just mentioned too.
Yeah,
Yeah, because
perfect.
Amazon can get cumbersome. The other option, just really quickly, is that's gaining popularity is those pill packaging,
Mm-hmm.
compliance packaging. We have a lot of the outpatient pharmacies do offer these compliance packaging
Mm-hmm.
options. We call them bubble packs, but again, you have to remember to push the meds out of the bubble pack. But the other one that's really gaining popularity, it almost looks like a candy dispenser to me. The ones
Mm-hmm.
that come out in a
A
sleeve.
strip. Yeah.
Yeah. And it's nice though that it tells you the medications that are in each one. The con of that though is if you do have a patient that needs to adjust their medications frequently, it is very challenging
Yeah.
to get those fixed and updated. So, and again, it's not the most ideal for memory loss, but I did just want to mention those options just to be comprehensive in what's out there.
Yeah, and those blister packages, I've seen, the downside of some of them is that it's easy to know whether someone has taken their dose,
Yeah,
but then it's also hard to adjust, especially if you just need to remove one pill
Yes.
from your morning pack, and you're like, oh crap, now where do I store all these other 5 pills that I just opened the little blister pack, and how do I remember to take that? So
Yes.
it's almost like it works well if you have a very stable list of medicines that
Yes.
you're just kind of taking every day without any um, changes, and because otherwise you have to sort of change it at the next month, like the next
Yes.
time the packaging is being delivered. You kind of have to make all the changes at once rather than making one change at a time, which is usually how I recommend for people to do it, because if you make multiple changes at once, then it's hard to know,
Yes.
is it drug A that made me
Yes.
feel dizzy, or is it drug B that made me feel dizzy?
Right.
Because all of it may be implemented at once. Yeah.
Yes.
Yeah. Okay. Well, switching gears a little bit, let's talk about the medications that are bad for memory. And then I know some of my audience have specifically asked me what kind of supplements are good for memory. So,
Yes. Yeah, and again, that's a great plug for pharmacists. So I'm so excited to be asked to be on your podcast. I think pharmacists sometimes can be an underutilized healthcare team member, especially the community pharmacists, to talk through which medications you do need to avoid, and especially the active drug list that you have with your pharmacy. We are big believers in trying to fill medicines at one pharmacy, so we have a full comprehensive list of what you're actually taking, and then that way we can do good drug interaction checks. So that's the number one thing we try to do. And then things to try to avoid for patients that do have memory loss. I'm actually really excited working in the population health field. We focus a lot on quality measures, and they're actually coming out with two new quality measures. I don't know if you're aware of them. They're calling them the poly CNS measures. And they're trying you're going to get some flags in the system to try to decrease prescribing opioids and benzos together. So those are obviously two medicines that we want to try to avoid for patients that do have memory loss. I
yeah.
try to
And the benzodiazepines, just to for those who don't understand, these are medicines like Xanax, Valium, Klonopin, and their corollary generic names. I call them alcohol in a pill. But the danger that Molly was saying about prescribing a pain medicine like morphine, oxycodone, hydrocodone, Percocet, along with these benzodiazepines, is that it can actually reduce people's desire to breathe, and
yeah.
people can overdose and die.
Yes. Yeah. And it really decreases your cognitive ability. So, ability to think straight. So, it does fog, gives you that brain fog. Even alone, those benzodiazepines, it's medicines that end in PAM, are the benzodiazepine medicines that we think of for generic. That's the generic ones. They're commonly prescribed in geriatric patients because they help with agitation or anxiety. But there are other options that are better to use to help with anxiety, such as Celexa or Lexapro. Or if you have a patient that doesn't want to eat, Remeron is actually a great option instead of that benzo. And
Yeah.
then the opioids, like if you do have a patient that's in true pain, we obviously want them to not be in pain. So we try to get them off the opioids like the Norcos or the oxycodones as quickly as possible. And they actually recommend to try to decrease taking NSAIDs. So NSAIDs are your anti-inflammatory pain medicines you can get over the counter, like Advil, the generics ibuprofen. Aleve is another common one. Those can actually affect how you're thinking as well. And so trying to decrease taking those, the best medicine for pain in a patient with memory loss is your Tylenol, your acetaminophen.
Yeah.
And then the
And
other measure that they are actually incorporating is trying to decrease patients on duplicate anticholinergic medications. That big word is essentially any medicine that helps you dry up. So the number one most common medicine that everyone loves is our lovely Benadryl. Um, and it is challenging to figure out which patients are taking those. But I have seen, and you probably have too, Mia, where, I mean, even my mom, I have had to try to tell her, like, you can't take 2 tablets of Benadryl every single night. Um,
Yeah, they're using that for sleep.
yes.
Yeah. Or
So
Unisum or Sleep Aid. A lot of those over the counter meds actually are Benadryl in a slightly different formulation.
yes, great call out. So, and then the other anticholinergic medication class are the meds that help with bladder control, which do affect our patients. And so it's challenging. It's always anytime we think of medicines, and as a pharmacist, we look at the medication list. I always say, you have to assess the benefits versus risk for you. And so every medication, everything you put in your body has a side effect. And everybody has a different side effect. And so it's really trying to figure out what medication you best respond to. Um,
Yeah.
Another common anticholinergic in that is hydroxyzine. We're seeing that prescribed a little bit more. It's almost like a stronger form of Benadryl, but people will put patients on it to help with anxiety because it has more mild side effects. It's actually an antihistamine just like Benadryl, but it does calm the body down. Or if you have like excessive itchiness, it's a good medicine to use. But in patients with memory loss, it can increase that memory loss and confusion and drowsiness and dizziness and
Yeah.
fatigue. So
Yeah.
really recommend more of using that natural melatonin. That's pretty safe to use for patients that need help with sleep. And even like low dose trazodone has been shown to be safe and effective in patients with memory loss.
Yeah, absolutely. For melatonin, my pitch to people is that most of the time people are taking it at the wrong time. They're taking it like a sedative right before bed when our natural melatonin is the highest around dinner time, like that sundowning time.
Uh-huh.
That's actually the time to take it. If you're taking it at 10 o'clock, it won't really be peaking until probably 2 o'clock in the morning.
Yes.
So that does not help. And then they come back and say, "Well, you didn't do anything." There are such a long list of medicines that are what Molly calls anticholinergic that we won't be able to fully review during the
Yeah.
podcast today. But you can certainly, either look online or talk to your local pharmacist to kind of say which one of these
Yeah.
you think could be affecting my memory. And to kind of add to the caveat about pain is that not treating pain can also be bad for memory. So it's such a risk benefit. Is Tylenol okay in terms of controlling your pain if you
Right.
take it 2 or 3 times a day consistently for arthritis? That's kind of constantly there and a little bit, kind of in the background, but could be affecting people's mood and agitation, or do you really need something stronger that technically may fall within the class of an opioid,
Yeah.
but not treating that pain can also be detrimental. So this is where, I think of it like the Goldilocks phenomena. You don't
Yeah.
want too little, but you don't want
Yes.
too much. You want
Yes.
it to be just right.
Just right. And everybody's different. And I mean, a very common, we consider it an opioid. It's not a controlled substance in some states, but some states it is, but tramadol. I don't know if you
Yeah. Yeah,
prescribe
I'm
that
not a
often.
fan. I'm not a fan of tramadol. We actually sometimes call it tramadont,
Yeah.
because it can have more side effects as well.
Exactly.
Yeah,
That's what like it's the pro con and it's being prescribed a lot. That's why I just wanted to mention it just because people I think some prescribers, especially primary care providers, think that it's not really an opioid, so it's okay, but it still has all those side effects as an
yeah,
opioid. So
right, exactly. So what kind of supplements are actually good for memory, if any?
yes. So I will say I grew up in a holistic household where I had a mother that didn't necessarily believe in prescription medications. So it's ironic that
And yet you are a pharmacist.
and that's why I think I'm the type of pharmacist that I am, and I do love geriatric medicine because the amount of polypharmacy that there is, the excessive use of medicines in our culture, and my philosophy is trying to decrease the amount of medications patients take. But with that, you go to my mom, she's on about 10 different herbal supplements, but she is very proud that she is on no prescription medicines. And the biggest caveat as I went through pharmacy school, and I always have to say this, is none of our OTCs or herbals are approved by the FDA. And so they do not, we don't know exactly how safe and effective any of them are.
Yeah.
There are quite a few over the counter that you can get. I think one of the most common ones that providers know about is Prevagen. I don't know if you ever use that, Mia, in your practice.
Never. I tell
Good.
people, please save your money. It is, I think that company actually has gotten into trouble for false
They have.
marketing.
That's what I was
Um,
going to mention. And I think a lot of primary care providers need to be educated on that because I
yeah.
think it's not to bash primary care providers, but
Yeah.
it's just, you Google, the first thing that comes up is
Is
Prevagen.
Prevagen. Yeah.
And there's
Yeah.
really no great studies. It's actually almost like the equivalent of just eating a lot of nuts. Um, so my,
Turn you a little nutty.
yeah, because nuts, what are nuts high in that can help with the memory stability is the vitamin E and the omega-3 fatty acids.
Yeah.
So I'm a believer in taking fish oil. I think it helps with multiple parts of your body. It helps with your heart and can help with your brain health. And it doesn't have to be that crazy expensive. Again, ask your pharmacist for help of which one might be best for you if you want to go that route, because there are so many different types of brands.
Yeah.
And there are a lot of
Absolutely.
brands out there that are not good.
Right.
Because
Yeah.
it's all about which active products there are.
In the
Um,
supplements.
mhm.
Yeah.
I think ginkgo biloba. I feel like I always say mispronounce that. I think that was really popular back in the day. I don't know if it's as popular now. And again, I say with caution, like be careful with any of these, just because we don't have we don't know how they're going to interact with your medicines you're currently on. And again, it's that benefit versus risk.
Yeah.
Just
There's
because it's
that.
over the
Yeah.
counter doesn't mean there aren't
It's
risks associated with it.
right. If you take enough Tylenol, you can get liver failure, and it's
Yes.
over the counter. But
Yes.
ginkgo actually is one where our center have been involved in a very large study looking at ginkgo for memory loss, and unfortunately, it does not help.
Yeah.
One of the most common supplements that I prescribe is really vitamin B12,
Yeah.
and usually I do check for a vitamin B12 level, because in people who are on an anti-acid blocker, like your protonics, your heartburn medication, that can inhibit the prevent the absorption of B12. If you're a pure vegetarian and you don't eat any meat, like my son, accidental vegetarian there, he probably is not getting enough B12 because he doesn't even like chicken. And that if you are having someone who has been through gastric bypass surgery,
Yeah.
parts of your stomach, or inflammatory bowel disease, where there's things that prevent the absorption of some of these vitamins, especially B12. We do know that low B12 can cause not only memory problems, but also neuropathy, where tingling in your feet, which then make you more likely to fall. So that is one supplement that I guess I believe in, because it
Yeah.
is actually beneficial. But most of the time, I think people are better saving their money and
Yeah.
saving the number of pills that they have to take by making sure every medicine does a benefit that you can
Yes.
see, or that if it's something that you don't notice a big difference, but but you want to prevent some future bad outcome like heart disease, heart attacks, or strokes. Sometimes after people had a heart attack, they suddenly are on 6 new different medicine,
Yeah,
and that can be hard to reconcile. But they do all have evidence at preventing a second heart attack.
correct.
So that's one of the few situations where I would say, actually, you are on more medicines now, but they do help you.
Yes.
But most of the time, it's the opposite, where there's usually a couple things that we could take off, or just change the frequency from every day to only if you need it. And then
Yeah.
if you truly need it, then you will notice if there's a benefit at the time that you need it.
Yeah, absolutely. And I will say another plug for vitamin B12, it tastes delicious. So I don't know if you've ever taken it, Mia, but it's usually a under the tongue dissolving tablet, and
Oh,
it has a good flavor to it. So my parents love taking their vitamin B12. So we are big
oh,
believers in vitamin B12. So I
I must
typically
have gotten the wrong brand because I got the pill form that was quite large. Oh,
no. You
okay. I
get
got to
the
switch.
dissolving tablet, and it's like a cherry flavor. You just put it under your tongue, and it actually tastes really good.
Okay. All right. See, now I learned something that I can change as
There you
well.
go. We're always
Because my,
helping each other.
yeah, that's right. Because my B12 was slightly low for some reason when my doctor checked it. Well, thank you so much for joining me today, Molly. I'll give you the last words. Anything else that you think that we haven't talked about that you want to mention to our audience?
I think that we've covered it all. I think that, again, as I stated, lots of different options. It can get overwhelming. I always tell people be your best advocate to your care, whether you're the patient or the caregiver, and don't hesitate to truly say what's going on, whether it's to your doctor, your pharmacist. On our population health team, we have fabulous community health workers and social workers, and we can really try to wrap around you and your team at home to really make sure that you are set up best be a, to be in the best place to take your medicines and feel the best. And I will say, lastly, as every Mia, you know this too, but the best thing too is those non-medication interventions. Like, are
Hmm.
you drinking enough water? Are you going outside and getting sunlight? Are you doing those types of things to keep your mood up?
Yeah.
I think that having a really good diet and eating good nutritious foods, big believer in that, because I think that food is the best medicine that we have, as well as exercise, even if it's just standing out on your front porch and moving your arms up and down, if that's all you can do. But
People, your neighbors might be like, "Say hi. Why are you waving
you
to
can
me?"
make a new friend.
Well, thank you so much, Molly. And I do want to add for people who might be wondering, how can I find a population health pharmacist? And I think usually those are associated with inpatient, hospitalization at perhaps at the time that you're about to leave the hospital. It may be even helpful to request to talk with a pharmacist or someone on the pharmacy team who can go through your medicines in detail. One thing that I actually do think will be really smart and really beneficial before people leave the hospital is to have their family members bring in all of the
Yes.
actual bottles that they take at home, because it's more common than not that what is showing up on the hospital list is
Yes.
different from what is at home. And it will be ideal if that can be reconciled before you leave the hospital,
Yes.
rather than going home and say, I don't know why they listed this medicine twice. Am I supposed to take the one I was on before? Am I taking this new one?
Yes.
But a lot of times it's just because the hospital didn't have your particular brand or formulation on their hospital formulary, and your doctor had to substitute for something, but
Correct.
then it causes more confusion later
Yep,
on.
definitely. And I will say that definitely ask if you're at discharge, but our population health team doesn't have to be attached to a hospitalization anymore. You can ask any of your doctors, to say, I'd like to talk to a pharmacist, and they can send a referral to our team. Um, at any time in our electronic health system. So it doesn't, and we can do a telephonic outreach. We can meet you in person, whether it's in your home or even if it's in collaboration with your clinic visit. We really try to meet the patient where they are in their healthcare journey to help them along.
That's great. If you're in Winston-Salem, you're in luck. If you're not, then you might have to ask your doctor about what's available in your local community. But
That's
thank you
true.
so much for joining us today, Molly.
Of
And
course.
thank you all for listening. We'll talk to you next time.
Thank